MMT, shoulder flexion, anterior deltoid and coracobrachialis. Assist the patient to the short sitting position. The patient should position the forearm in pronation. Allow the feet to rest on the floor or step stool. Stand at the test side close to the arm being tested. Passively flex the patient's shoulder to 90 degrees, keeping the forearm pronated. Support the arm under the elbow joint with one hand. You are not assessing the infield, you are determining how much range the patient is able to move the shoulder in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to flex the shoulder to 90 degrees while keeping the forearm pronated. Stabilize the patient at the shoulder. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include leaning back to use momentum to help with flexion. The patient may externally rotate the shoulder to recruit the long head of the biceps. The patient may also shrug the shoulders to assist with flexion. Horizontal adduction may also be seen as the patient recruits the pectoralis major to assist. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the shoulder with one hand, and the other hand is contoured over the distal humerus proximal to the elbow. The resistance is applied in a downward direction toward the floor. Grade 5, normal. The patient completes flexion to 90 degrees and holds against maximal resistance. Grade 4, good. The patient completes flexion to 90 degrees and holds against moderate to strong resistance. Grade 3, fair. The patient completes flexion to 90 degrees but does not tolerate any resistance. There is no position change for grade 2, 1, or 0. Grade 2, poor. The patient completes partial range of motion of 90 degrees of shoulder flexion. For grade 1, stand at the test side close to the patient's arm. Palpate the anterior deltoid by placing your fingers over the superior and anterior surfaces of the shoulder joint. The patient attempts to flex the shoulder to 90 degrees with the forearm pronated. Grade 1, trace. Palpable contractile activity of the anterior deltoid with no motion. Grade 0, no palpable contraction.